living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Many people have difficulty differentiating between heart attack and stroke. Although both are cardiovascular emergencies, they present with different symptoms and have different treatment options. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Colleen Roylance. Today we'll talk about the differences between heart attack and stroke and what successful rehabilitation looks like. Stay with us. Welcome back to Healthy Living for Life. Joining us today is Dr. David Wheeler. He is a neurologist and American Hospital Association's 2019 Physician of the Year. He's with Wyoming Neurological Associates. Dr. Wheeler, thank you so much for joining us.
Thank you. It's a pleasure to be with you.
Let's talk about heart attacks and strokes, and we'll start with some definitions. What is the difference between a heart attack and a stroke?
Let's start with heart attack. So a heart attack is caused by the loss of blood flow to some part of the heart muscle. So usually what happens is one of the arteries that supply blood to the heart itself, called coronary arteries, becomes obstructed, usually by a cholesterol plaque that may grow to fill up the blood vessel or might actually spontaneously rupture and then blood clots form inside of that artery. And as soon as the heart muscle loses its blood flow, the heart cells start to get really, really sick. And we have these processes in our body that alert us very, very quickly if the heart muscle starts to get sick. And so it causes the sudden onset of some pretty significant symptoms that can vary from one person to another and can be quite different between men and women. But there are some common themes here. Most often when a heart attack starts, a person will experience some very specific type of chest pain, often referred to as crushing chest pain or pressure, like an elephant is sitting on your chest. Along with that, some people may experience some pain or discomfort in their left arm, in the left side of their jaw. Many people will experience very extreme sweating, or what we call diaphoresis. And then, especially in women experiencing heart attacks, nausea and confusion are common symptoms as well. So that's the classic picture of what we call a myocardial infarction, or a big bad heart attack. There are milder versions of this where the symptoms come and go and might even only be present with exertion or exercise. So if a person is, tries to take a short walk across the house and experiences some chest pressure or a little bit of arm pain that goes away when they start to rest, that is also a heart attack, but it may be less severe and less likely to cause permanent injury than the first type that I explained. And we refer to those as NSTEMIs, or non-ST segment elevated MIs. And that ST segment elevation is a description of what the EKG is doing during a heart attack or myocardial infarction. So either of those are medical emergencies, and the most important thing to do is to call 911 so that you can get as quickly as possible to the nearest facility that can take care of that heart attack. A stroke is similar in its mechanism, but obviously is similar in its mechanism, but quite different in its symptoms. So like a heart attack, a stroke is usually caused by the sudden loss of blood flow to a certain portion of the brain, which leads to brain cells getting sick. And we'll go into the symptoms that may cause in a second. But at this point, I want to let people know that there's more than one type of stroke. What I'm describing now is called an ischemic stroke, which, like a heart attack, is caused by loss of blood flow to the brain. But there's another type of stroke called a hemorrhagic stroke, in which a blood vessel ruptures inside or next to the brain, and the blood escapes into the brain, and that's what causes the symptoms there. In either case, the symptoms of stroke vary dramatically depending on what part of the brain is affected. So unlike the heart, which has one basic job, which is to pump blood around the body, and usually causes very particular symptoms: the pain and the sweating and the discomfort in the arm and the jaw. By contrast, a stroke may cause a whole variety of symptoms, with some common ones including sudden loss of strength, especially on one side of the body, sudden loss of sensation, especially on one side of the body, the sudden onset of confusion, inability to speak or understand speech, loss of vision, or very sudden severe headache. And so the part of the body that is affected by the stroke depends on which part of the brain is affected, and which symptoms you get depend on a few things, like how big the stroke is and where in the brain it's occurring. And that all depends on which blood vessel it is that's become occluded. So the symptoms can be quite different from one person to the next. But there are some common themes that are important to know about. So important, in fact, that we've developed a memory aid to help people recognize the symptoms of an acute stroke. And so we encourage people to think of the word FAST. And FAST, F-A-S-T, stands for face, arm, speech, and time, because time is brain. So if you experience the sudden onset of facial droop or inability to move one side of your face, or if the person can't hold both arms up in the air without them drifting down, or if they can either speak or understand speech, or if their speech is garbled, then the most important thing to do, like in a heart attack, is to call 911 so you can get to the hospital and get as quickly as possible into the treatment for an acute stroke.
That is really, really good information. I think you've made it very clear the differences between heart attack and stroke. And it sounds like there can be more severe or less severe. But I have another quick question for you before we take a break. Is one more dangerous than the other?
I'm a little biased because I'm a brain doctor, so I tend to be more worried about protecting the brain. But the true answer is no. Both are very dangerous. Both are potentially fatal, or at least severely disabling. And in any case, whether it's mild or severe at its beginning, both are very treatable. And so if you get to a hospital quickly where treatment can be delivered, there's a much better chance that you'll come through it without major problems and be able to be better going forward. So one is not worse than the other. There are many more heart attacks than strokes every year, but because of advances in treatment, more people survive heart attacks than strokes. So the death rate from stroke is a little bit higher, but the long-term disability from stroke is a little bit higher. But in any given year, way more people have heart attacks than strokes.
Thank you, Dr. Wheeler. We have to take just a short break. When we come back, we'll continue talking with Dr. Wheeler and look into what some of the treatment options are for heart attack and stroke. Don't go away. We'll be right back. Welcome back. Dr. Wheeler is still with us, and we are talking about the differences between heart attack and stroke. Dr. Wheeler, talk to me a little bit about the duration of a heart attack, duration of a stroke. Are there different durations?
Yes, but there's a lot of variability in the answer to the question. So let's talk about heart attacks first, which, as we discussed a little bit earlier, can come in slightly different forms. Both are medical emergencies, so don't make the mistake of thinking because it might be less severe that it's any less important, because a mild heart attack can turn into a severe heart attack without any warning. So don't always call 911. I want to say that up front. But yes, there are differences in severity, and it has mostly to do with how much of the heart muscle is being affected by the heart attack. And that has to do with how much blood flow is stopped by the artery getting blocked up. So if a person has blockage of one of the main arteries, for example, the LAD, or left anterior descending artery, which is the biggest artery in the heart, and if it gets plugged up, or in fact, if the little branch right before that gets plugged up, we call that, well, it's an old term, but they used to call this a widowmaker, because almost nobody survives this unless it gets opened up within just a matter of minutes. So that's one example of a very severe heart attack that has a poor outcome for most people. The a less severe heart attack might occur if a much smaller branch of those arteries gets blocked up, and so a smaller piece of the muscle gets affected, or if the artery isn't completely plugged up, but the blood flow is slow enough that the surface of the heart muscle starts to suffer. And that's what we call the end-STEMI, where the injury to the heart muscle doesn't go all the way through from the outside to the inside, but begins on the surface and is spreading quite gradually. You need to get emergency medical treatment in either case, but there's a better chance of fully recovering from a milder heart attack than a more major one, unless in the case of the major one, you get emergency treatment very quickly. The discussion of the severity of strokes follows really a very similar logic. So if a person suddenly loses all the blood flow through their carotid arteries, or even both carotid arteries, which can happen sometimes like after a car wreck or something like that, there's almost no chance of surviving a stroke like that. That's not very common, thankfully, but every once in a while we're faced with a case like that. And if we can't get that person into treatment within a matter of minutes, then there's no chance for them to survive. Much more common are what we refer to as large vessel occlusion strokes, sometimes referred to as LVO. And LVO strokes are very, very severe, but also potentially treatable. So if we're able to go inside of the brain and pull the clot out before too much permanent damage occurs, then those people can have a pretty decent outcome. And then continuing down the spectrum of severity, you can have occlusion of successively smaller branches of those arteries in the brain, with smaller and smaller parts of the brain being affected, all the way down to the smallest capillaries, which may not even cause any symptoms that they get plugged up, or if they do cause symptoms, they can sometimes be kind of mild. So it might just be some numbness on the side of the face or a little clumsiness of the hand. However, there are places in the brain where even a tiny little stroke can cause massive symptoms. For example, in the brainstem is a very, very small structure, and all of the information going in and out of our brains has to go through the brainstem. And so if you have a small stroke, even the size of a pea, in an area that important for brain function, the symptoms of it can be really devastating. So in either case, stroke or heart attack, the relative severity of the injury or the attack depends on how much of the brain or how much of the heart muscle is affected by the stroke or the heart attack.
You know, you've really made calling 911 the first thing you need to do very important. What can you do at home? Is there anything you can do at home? You know, and I'm thinking some of our rural folks, and they can't get an ambulance there right away.
Right. The recommendation for somebody experiencing heart attack is if you've been prescribed any medications to take care of heart pain or what is referred to as angina, for example, then it would be appropriate to take those medicines. So that might include chewing up 4 baby aspirins, for example, or putting a nitro tablet under your tongue to try to get rid of the chest pain. If you've never been diagnosed and don't know for sure what's going on, it's probably better not to take any medications. When it comes to stroke, that recommendation is even stronger. So we often encounter people who, because they think strokes and heart attacks are very similar, and because they've been told to take an aspirin for a heart attack, they sometimes think it might be a good idea to take an aspirin for a stroke. But we would absolutely ask people not to do that, because you'll recall some strokes are caused by ruptures of blood vessels and bleeding into the brain. And if you take an aspirin, it may make that bleeding much, much worse. And so as far as medications are concerned, we strongly encourage for stroke not to take any medicine. And in the case of heart attack, to only take medicine if you've gotten previous instruction from your doctor to do so. The most important thing, as we talked about, is to call 911, to know what the symptoms of stroke and heart attack are, which we've covered, and then to call 911. And we in Montana and in Wyoming are trying as hard as we can to develop emergency systems of care to make sure that no matter where you are in our states, that you have the best access not only to the transportation, but that transportation, whether it's by helicopter or by ambulance, will take you to the nearest appropriate facility. So that is an emergency room that can provide the level of care that's necessary to save your life. And sometimes that's the closest hospital, and sometimes it's not. And it depends on whether, in the case of heart attack, whether they have the ability to make the diagnosis and provide the emergency treatment, and whether they can arrange for transport to a higher level of care if necessary. And for stroke, it depends on whether they have CAT scans and the right kinds of doctors and things like that.
Thank you. I think that's very helpful. We're going to take another short break. And when we come back, we'll continue talking with Dr. Wheeler and talk a little bit about rehabilitation. Stay with us. We'll be right back. Welcome back. Dr. Wheeler is still with us, and we're going to talk a little bit about rehabilitation. Dr. Wheeler, once someone has experienced a stroke or a heart attack, what does rehabilitation look like for either one of those?
I want to preface my answer by saying I'm much more familiar with rehabilitation from strokes than from heart attacks, but I will do my best to kind of cover the former. So let's start with that. Really, in either case, the amount of rehabilitation that's required is obviously dependent on how severe the heart attack or stroke was. In those depend first and foremost on how bad it was from the beginning, and then secondly, how effective was the emergency treatment that the patient was able to get. And so, in the case of surviving a heart attack, it may run the gamut from having very severe heart dysfunction because so much of the heart was damaged that its ability to move blood has been compromised. And so that person may have a very long course of recovery where they have to accommodate their whole body to getting by on less blood flow and less blood pressure. And that can take, first of all, a lot of medications to help the heart squeeze more strongly, but also to rehabilitate the muscles in the lungs so that they can start to get by on less blood flow than it used to get. The more often, since so many people are able to get emergency treatment that's effective, the damage to the heart muscle is less severe and not necessarily reversible, but you can over time strengthen the rest of the heart and the rest of the body to accommodate for the damage that occurred. And so those folks may undergo a short course of cardiac rehabilitation, which would start certainly in the hospital after the treatment is done. You begin your rehabilitation right away. So you learn how to breathe more effectively. You start strengthening your legs, working on your balance, and sometimes those folks may go on to an inpatient rehabilitation facility, or more often they'll enter a course of outpatient cardiac rehabilitation, which is a several week course of much of it learning how to live a healthier lifestyle. So eating better, good hydration, learning how to take your medications, and then increasing your cardiopulmonary function to help to overcome the damage that occurred as a result of the heart attack.
I wanted to ask just a quick question. Is physical therapy part of the recovery process?
Yes, so physical therapy is a critical component because learning how to exercise well without overdoing it, but also doing it in ways that help to strengthen the cardiovascular system is incredibly important. And that's an area of expertise for physical therapists. So they're 100% important for and centrally involved in the rehabilitation process.
And to your knowledge, do most medical plans, insurance plans cover rehabilitation after a stroke or a heart attack?
To my knowledge, almost all reasonable insurance plans will cover some rehabilitation. It isn't always as much as the patient may need. Some insurers will limit the number of days in a given calendar year that a person can receive rehabilitation therapy. Although often, if the physicians directing the therapy are able to successfully argue that a few more days would be helpful, then exceptions can be made. But yes, my understanding is that the vast majority of people who have in either commercial insurance or government-funded programs are eligible for rehabilitation after a stroke or heart attack.
And once you've had a stroke or a heart attack, what are the odds that you might have a second?
In either case, the odds of another event are significantly higher than they were before you had your first event. So now we know, statistically, we understand that that individual is at risk for stroke or heart attack for whatever reason it occurred, most commonly because of hardening of the arteries or atherosclerosis. That being said, in either of those cases, the doctor is taking care of the patients when they come into the hospital, do all the things we need to do to know why the person had a stroke or heart attack, and then adjust their medications or do interventions, including sometimes surgeries like heart bypass surgery or carotid artery endarterectomy to fix the problem in order to lower the risk of another stroke or a heart attack. So we can't ever make a person's odds of the next one zero, but we can get them closer to what their odds would have been for somebody else at the same age who hasn't yet had a stroke or heart attack. And that's usually the goal. So we figure out why it happened and then do whatever treatments are possible to lower that risk in the future. So
recovery might take quite a while, even after you've left cardiac rehab.
That's right. And also for stroke recovery, which I'm definitely more familiar with. So what I would describe there is that in both cases, a lot of the recovery happens in the first couple of weeks. And you can get a sense of, is that person going to recover completely in those first couple of weeks, or are they going to have a much longer course of recovery? And so in the case of stroke, what I tell folks is that the most obvious improvement is going to be in the first, say, 2 to 4 weeks. And then after that, if they're not all the way better, the recovery will continue, but it'll be a little bit harder to appreciate on a day-to-day basis for the next 6 months or so. And then there's still recovery that can happen for the next couple of years after that, but that might be hard to appreciate unless you're only checking in like once a year or something like that. So it's fast in the beginning and then it slows over time. But there's no question that being actively engaged in your rehabilitation program, whether that's at an inpatient hospital rehabilitation or your home exercise therapy plan, active participation in that recovery plan will make the early recovery go faster and will make it more likely that you'll get to your maximum improvement in a much shorter period of time.
Dr. Wheeler, thank you so much for being with us and sharing all of that really helpful information.
It was my great pleasure. Thank you for having me.
And thank you for joining us. Join us again next week, and until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.